In this video, I'm going to talk about wounds, or more specifically, wound healing, burns, and skin cancer. A wound is a break or an opening in the skin. Sorry about that typo. And because there's been a break in this outer protective layer, there's the possibility that bacteria can enter under the skin, get involved in your connective tissue and even down to your muscles perhaps, and cause infection. And that's the problem with wounds. You do not want to have the bacteria growing in your body. Wounds can be quite superficial, not very deep at all, or so deep that they reach down into that muscular layer or even to the bones. When we talk about wounds, these are things like cuts or scrapes, punctures, pressure sores, which also get called bed sores, and burns are also considered a wound. Now, while minor wounds can usually heal very easily, any size wound can become infected. And so you want to make sure that you take good care of any break or opening in your skin that will occur. There are 4 stages to the healing process for a wound, and we're going to go over each one of these stages in more detail in the slides to come, but they include hemostasis, inflammation, proliferation, and then remodeling. So hemostasis, the first stage, occurs during those first few minutes after an injury. Hemo here refers to blood. Stasis means to hold steady or to stop. And during hemostasis, platelets, which are part of your blood, one of the types of cells in your blood, they stick to the damaged tissue. And as they stick, they release a chemical signal that will take protein, known as fibrinogen, and turn it into fibrin. This protein is part of also in your blood. It's present there all the time. And once it's activated by this chemical from platelets, it is able to form a mesh that will trap more platelets and eventually form a blood clot. Initially, your blood vessels will constrict. They will tighten up. That's vasoconstriction to slow the bleeding. But when you move from the hemostasis stage into inflammation, which then occurs sometime in that first 24 hours and can last for several days, we actually have blood vessels go the other way, and you have vasodilation, which allows more nutrients such as oxygen and glucose and other supportive materials to be brought to those damaged tissues. But while doing that, some of the plasma, the liquid that blood cells are carried in, will be leaking into that tissue, and that's going to increase the swelling. So swelling is part of the side effects that you see when there is inflammation, and it is really representing a good thing because that's telling you there's more blood flow to that area, bringing those important nutrients to do repair. Along with vasodilation, another thing that happens during inflammation is that there are various types of white blood cells that migrate to that area. White blood cells have the job of removing damaged tissue, taking care of waste products and debris, and also destroying any invading bacteria. So they're part of the immune system. They're there to take care of those pathogens. Your fibroblasts, the cells that produce the protein fibers that are part of your connective tissue, also move into the wound area and start producing collagen to basically tie things together. Inflammation will last as long as debris is present, so it's important to clean a wound as best you can to decrease how much time your body spends in inflammation. Here are 2 pictures to just show these things happening. So we've had a wound happen, blood vessels have been cut, bleeding has occurred. This can also help clean out the wound initially. But as this blood fills the wound, the platelets that are present in the blood will begin to stick to damaged tissue. They will cause fibrinogen to turn into fibrin, and then we have a mesh developing of the proteins to hold those platelets and to hold the blood cells to create that blood clot. After inflammation occurs, you have the leukocytes, the white blood cells, including macrophages, which are really the cleanup crew, and neutrophils, which take care of that invading bacteria. They move into the area to do their job, and then also the fibroblasts that are going to build protein fibers, collagen fibers, to tie everything together across both sides of the wound. The next stage, proliferation, can occur really alongside inflammation and usually lasts about 1 to 3 weeks depending upon the depth of the wound. During proliferation, we have angiogenesis, forming new blood vessels. That's what that word means, to again increase the blood supply to that area so that the tissues that are being built have plenty of nutrients to have as a resource. The fibroblasts develop not only the new collagen, but the whole new extracellular matrix to replace that damaged tissue in the connective tissue. Epithelial cells actually leave where they are along the edges of the wound and migrate into the center to form a new thin layer at first on top of the healing tissue. Depending upon how large the wound is, you may not be able to get a full connection of epithelial cells all the way across the top, but they will try to kind of fill in the gap so that you can replace that epithelial layer. Wound edges also are pulled closer together, primarily by these proteins that are being developed by your fibroblasts. And then after about 3 weeks, when the wound really looks kind of healed to us on the outside, there are still things happening on the inside. The collagen fibers that have been produced, they are just really kind of thrown down every which way in a hurry to get that wound bound together. And so then they're realigned so they look more normal for what is found in tissue, in the skin tissue, whereas that irregular, dense connective tissue. Any cells that were there, perhaps those extra blood vessel cells, when they're no longer needed, they will undergo apoptosis. Remember, that's cell death. And any extracellular matrix materials are also reabsorbed and removed. The new tissue that you build after a wound is not exactly like the original tissue. It has a strength that's about 80% as strong as the original, but that is strong enough pretty much to do what you need that tissue to do. So again, some pictures we see here in proliferation. We've got new blood vessels growing in to connect where they had been lost. You've got lots of fibroblasts here building collagen to help tie that connective tissue together. The tissue that's rich in blood supply is called granulation tissue. And if you sometimes pick a scab off, you notice that new tissue underneath is pinker than your surrounding skin, and that's because it does have some extra blood vessels at this point. And then the remodeling stage, you can see that we have restored this epithelial layer, so cells have been able to build in all those layers again of the skin, and there are not as many fibroblasts or as much connective tissue present, or not much collagen fibers present in that connective tissue. Next, we want to talk about burns. Burns are a type of tissue damage due to extreme amounts of heat or application of electrical current, or perhaps some radiation, some high energy invisible light rays, or some irritating chemicals that can damage skin and make it appear that it's been burned, like you have in a heat-related burn, a thermal burn. If you look at figure 1, you can see that the various types of reasons for somebody to have to go to the hospital because of a very bad burn, and that most of them are involved with direct heat. Here we have burn from heat that doesn't involve fire, burn from a fire or flame, and then burn from scalding, which is very, very hot water. So heat is the primary culprit when it comes to burns. Burns can have life-threatening consequences because tissue is being damaged, especially when there's a large amount of the body has suffered a burn. And so you're going to be losing body fluids from that damaged tissue because your skin helps keep the liquid that's inside you. So there'll be fluid and electrolyte loss from the wound seeping out of the wound, which then also includes increased evaporation from the surface tissues because we no longer have that barrier of skin, which can lead to dehydration and circulatory shock. As a side effect, the immune system is not so effective. It can't work as well. And the barrier, just opens the body to potentially a lot of infectious agents moving in. And so burns are a very serious condition. The greater amount of the body that's been burned, the more dangerous it is. There are 3 types of burns I want to go over. Burns that only cover or only destroy part of the skin or partial thickness burns include first-degree burns, where you're only affecting the epidermis, and second-degree burns, where injury goes in both the epidermis and the dermis. Typical signs of a first or second-degree burn is a reddened skin. They can feel quite painful. In second-degree burns, you often get blisters because the inflammation, again, that the fluid there is coming from the plasma, which moves out of the bloodstream. This same liquid, when it's outside the blood, is called lymph. When it's inside the blood, it's plasma. When it's outside the blood, it's lymph, but it's the same thing. And during the repair of burns, you will see regeneration of the tissue occurring from the epithelial cells, or if it has gone deep into the dermis, you'll have some of your connective tissue cells, your fibroblasts, also involved. So again, an illustration, first-degree burn, you can see the damage here is still into the epithelial layer only, because here's the barrier between the epithelial and the epidermis and the dermis layer. And then in a second-degree burn, we have had the damage go down into the dermis layer, because here would be the line between the epidermis and the dermis. Some pictures of some first and second-degree burn, dark red skin. That's a pretty painful sunburn there. Blistering from the leakage of the plasma out of the blood. So this is typically what you would see with those first and second-degree burns. Then the third-degree burn is known as a full-thickness burn because it destroys all 3 layers of skin, at least in some areas. Interestingly, third-degree burns are initially not as painful because you've destroyed those nerve endings. So if you don't have functional nerves, you're not going to feel the pain. It can appear red or white or black, depending upon what kind of substance caused the burn and what parts of the tissue were destroyed. In full-thickness burn, you will not get regeneration of the epithelial cells, the epidermis on the top, and so skin grafts are required to provide that barrier that we need. Burns that cover more than 25% of the body often require UV fluid, intravenous fluid supplementation, because there will be so much loss of liquid by dehydrating, just kind of evaporating off that burned surface. And if 30 or 40% of the body is covered, they may actually be fatal. In order to figure out this percentage, doctors use something called the rule of 9. So if you look at these little diagrams over here, you see parts of the body have been divided into sections, and each of them given a value of 9 or a value half 9, 4.5 for your head. Genitals are one exception to that. And so doctors can quickly assess, well, where is the burn covering? If it's covering the back and the buttocks, then it's about an 18% burn. And so that would be something that might need some IV fluid supplementation. And so this is called the rule of 9s, and it's the way of determining how much of the body has been affected. Here's the illustration again of a third-degree burn, damage all the way down into the hypodermis, maybe even to the muscle layer. Here's an illustration of what it might look like, and then what a skin graft will look like after it's healed. So you can see this patch of skin has been added, coming from, usually donated from some other part of the body to fill in that area. I want to just mention quickly first aid for burns, since most people will experience burns some point in their life. Minor burns, the first and second degree burns, the most important thing to do is to cool the burn by using cool running water or cool compresses, fabric that's in cold water, or soaking the affected area in water itself, but don't use ice. You never want to apply direct ice to your skin anyway. It's much, much too cold. And then, of course, cover with gauze, especially if it's a second-degree burn, and just watch for signs of infection. But if it's a third-degree burn, call in the emergency services and basically just try to keep the person comfortable. You don't want to remove burned clothing because you can take away parts of the skin with it, and you don't want to do that in an unsterile situation. You don't put somebody in cold water because that can cause actually a drop in body temperature, which will lead to hypothermia and potentially shock. You want to elevate the burned body parts, so raise them up. So keep the fluid inside the body by sending it back to the heart instead of letting it drain out by being pulled by gravity. And then, of course, cover the area to protect it from any more dirt and debris getting into it, using something that's cool and moist. If there's a sterile bandage, that's best, but you can always just use any kind of cloth that you have that is clean. Lastly, I want to talk about skin cancer. Skin cancer is caused by damage to the DNA of the cells in the epidermis because of ultraviolet radiation. Also, skin cancer can be triggered by skin being frequently irritated by chemicals or infections. Those can lead to damage to DNA as well. 1 out of every 5 Americans will experience skin cancer in their lifetime. It is the most common form of cancer in the United States. And so it is something you need to be aware of, and you need to be looking at your own skin to keep track of how things are developing. There are certain things that put you at greater risk for skin cancer. Being exposed to sunlight, either a prolonged exposure because you work in the outdoors or a severe sunburn, both put you at risk of skin cancer. The type of skin you have, the lighter colored the skin you has, tells you there's less melanin. Melanin's job in your skin is to provide protection to the DNA in the nucleus of the cell. So if your skin doesn't produce a lot of melanin, you're at greater risk of your DNA being damaged. If there's a family history or some type of inherited genetic condition that make you more susceptible, that will increase risk. Age in general is a risk factor for cancers. The older you get, the more likely you are to have some kind of cancer just because your body is breaking down with age. So doctors have also found that people who have a lot of moles, more than 50, or moles that are larger than normal, or they don't have this regular kind of roundish shape, they're atypical, also put you at slightly risk for skin cancer. And then if you're someone who's suffering from a weakened immune system because of some other condition, or you are challenging your body by putting in the chemicals that are part of smoking, or you are getting excess levels of radiation, say you are traveling as a pilot, and so you're often flying in the higher altitudes, so you get greater cosmic radiation exposure at that point, or a long-term skin inflammation or injury can all also be risk factors for cells to go bad and become cancerous. There are 3 types of skin cancer. Basal cell carcinoma is the first type I want to talk about. It is the least malignant. It's not one that is particularly dangerous. It is also extremely common. This type of cancer happens because the stratum basale cells, those cells that are doing mitosis and dividing to make more cells for your epidermis, they are reproducing too rapidly. Cancer just generally means cells are not dying when they're supposed to, and so they just keep on reproducing. And so these cells then move into the dermis and the hypodermis. They are usually found on exposed skin on older adults, probably caused by just long-term exposure to ultraviolet radiation. And they are, because I said, not particularly malignant. They're slow in growth. They tend not to metastasize, to move around and create tumors in other parts of the body, and are very easy to remove surgically to give you a full cure. The second type of skin cancer is squamous cell carcinoma. And so this is arising from the keratinocytes of the stratum spinosum. That's one of those middle layers on your epidermis. These may metastasize, moving into lymph nodes, and are also caused by prolonged exposure to the sun. So this is a little more dangerous because this metastasizing tells you that the cancer is going to move away from its original site and invade other body tissues. But if caught early enough, this is easily cured by surgery or potentially radiation. And we just have some pictures for you to see what squamous cell carcinoma looks like in comparison. And last of all, we have malignant melanoma, and this is the most dangerous. It comes from melanocytes going bad, and so since melanocytes are the cells that produce melanin, those are the cells that have more color, and so this type of cancer, you see brown or black patches that will spread, and they metastasize into the blood to travel to other parts of the body or to the lymph nodes. Melanoma, we found, is related to severe sunburn rather than prolonged sun exposure. So if you've had one bad sunburn ever in your life, you are slightly at risk of melanoma. It is treated by surgery and potentially chemotherapy, depending upon how severe it is, how early it is caught. These are just some illustrations here to show you what a melanoma might look like. Because melanoma is so dangerous, there is the ABCDE rule to help you evaluate any spots you have on your skin. A stands for asymmetry, so that means if you split it down the middle, it does not look exactly the same on either side. So if we divide it this way, you can see this side is, slightly higher over here than on the other. This side is slightly lower. The border is irregular. It's not a round mole with a nice smooth border, but it has a very jaggedy edge. That's another sign it's potentially cancerous. Color, does the color change? So we see some darker areas, some lighter areas. That color variability is another sign of potential cancer. Size is the fourth one. So if the diameter is greater than 1/4 of an inch, or about the size of a pencil eraser, that is a risk to say this may be cancerous. And then the last one is evolution. Has it changed over time? So we see, the size of this spot here has gotten larger and darker in color. And so all of these characteristics point to a spot on your skin that may be malignant melanoma and should be checked out by your doctor. So it's really important for you to know your own skin because skin cancer is so common. So know, where do you have moles and what do those moles look like? If you have a large mole, but it just sort of stays the way it looked like this last year, it looks like this next year, it looks the same way the year after, it probably is not a sign that this is going to go cancerous, but you do want to check on it. So check periodically to see if there's any changes happening to these spots and moles on your body. If something starts to look a little different or you're worried about it, go to the doctor and ask for a biopsy where they'll take a tiny cut of those cells, send them to the laboratory, and then the lab technician can look at the cells under the microscope and determine if they are normal-looking skin cells or if they look like something different, like they could be cancerous cells. And then just general healthy eating, choosing the right foods, keeping yourself physically fit, getting enough sleep, not letting stress overwhelm you, are all things that affect your overall body conditioning, and that also will impact on your chances of getting any cancers. So check for your understanding. Can you describe the 4 stages involved in wound healing and talk about the key events that happen at each stage? Can you differentiate between the 3 types of burns and describe the amount of skin damage that's found in each type? Can you list the risk factors for skin cancer development and describe these 3 different types of skin cancer? And can you explain what you would do to apply the ABCDE rule to determine if a spot on your skin is a melanoma? As always, if you're not sure of the answer, go back and watch these parts of the video again.